Hello everybody, happy Wednesday again. We are going live today with Chava Abramovitz, an amazing therapist who specializes, or one of her specialties is in psychedelics, specifically ketamine-assisted psychotherapy, KAP. Hello Shoots Photography, thanks for joining. Hello Chava Abramovitz, amazing, thank you for joining. Let me see how to add you. Let's do this. Chava, do you see like where you could request to join, or I can do it. I got it too. Hi Chava, that was super fast and amazing. I'm very impressed. Not surprised, but very, very impressed.
Nice. Thanks for having me, Faye.
My pleasure. Thanks. This is very impromptu, everybody. We were like in talks the past week and we're like, let's just do it. It's going to be a very brief live about this topic, and then we're going to open the space for questions for people to submit questions, and then we will have another live, God willing, next week where we answer those questions. So Chava, the mic is yours to just introduce yourself a little bit, tell people who you are briefly, and then we can jump right in.
Hi. Okay, so I am a worker, licensed clinical social worker. I'm in Muncie, and I graduated in 2013 from Fordham, and I've been working in the field since, mostly in private practice. Started out in the clinic. And as the years went by, a person has to kind of specialize, and it seemed like everything was trauma related. Attachment. So that's where I kind of went. So I've done training in EMDR and IFS, Internal Family Systems. And the past few years, I've really spent a lot of time doing somatic psychotherapy. So getting the body involved. And as I've been reading over the years, psychedelics have become a rather mainstream adjunct to what's been talk therapy, even though it seems like, wow, we added our body to, it's not just talk therapy now.
Yeah.
Now we're adding our unconscious mind and helping it be accessible through the help of medications. So that's what I'm doing now, and I'm excited to tell you about it a little bit.
Amazing. So yeah, it's a very new space, and I feel like it scares people, which is why like I was so happy to have like a model of a really normal, grounded therapist talk about this with me, and that's you. Because I feel like people get really scared off, but if it's presented, in the right way, I think that it will at least people open up people's minds to it, and no pun intended there. But like, I think that doesn't mean that people have to go now and like start using psychedelics, but I think it's important for us as a community. One of the things I'm so passionate about is like making the community at the forefront of mental health versus always like lagging behind, and in many ways that we lag behind for very good reasons many times. But I think that we can take a step forward and kind of like keep pace with the rest of the world in a healthy, religious, culturally appropriate way. So, and I think that this is one of those ways that we should be educated and get the education from the proper sources, and you're one of those sources. So that's kind of like my 2 cents there. So if you could tell us, I guess, like what are psychedelics, and like what are they? Why do people use them? I guess that's like a good basic question.
Yeah, it is kind of exciting that I've in the past year gotten myself educated a little bit, because to me, being from the 60s, psychedelics were what the hippies did, and were very off the beaten track, and not something I wanted to associate with. And now, well, so they actually went underground, and people continue to use them and experiment on them. And for the past 20 years or more, since the 1990s, government's actually been funding studies at the biggest universities in the country to study these things, because they understood it was such a powerful type of medication. There had to be a good use for it. Psychedelic really, comes from Greek psyche, and it really is a substance that can either be man-made or naturally found in plants that can alter a person's state of awareness. It kind of can break down our typical ego defenses that we've learned to protect ourselves with, and allow access to what's usually more unconscious, and back from our conscious memories, but really influencing who we are, what we do, how we react all the time. So there are many applications for it, of course, depending on where the person's coming from. But that's the idea of this class of medications. But what medicine is doing now is putting it into a measurable, evidence-based forum that is done in the safety of a clinician's office or a person's home with a clinician, and allowing people to prepare for what they call a journey sometimes, and
or a trip.
have the ability to really make something which used to just be for recreation, mind-blowing experiences, something that can really help heal very serious mental health.
Sure. Can you speak a bit about, and without going into all the specifics, I guess, but the difference between, like, I feel like psychedelics is the umbrella. So then there's MDMA. I always think I left out a letter, but I didn't. And then there's KAP, and then there's other ones, I'm sure. So like,
I really have trained and gotten certified in ketamine assisted therapy. It's called KAP for short. Ketamine is a man-made drug. It was created in 1962, and it's been used since then in hospitals all over the country to put people to sleep for surgeries. It's also a pain reliever, an analgesic. Used in much smaller controlled doses, it can create a medium real dissociation from one's ego self. And in even a lower doses, which what I do clinically, it's called psycholytic. It's just kind of an easier, more like a trance-like, semi-hypnotic, not that someone hypnotizes you at all.
Right, but it's funny when as we were going on this live, I was thinking, the question came to my mind of like, isn't this similar to hypnosis? And I don't have a bad association with hypnosis. I think hypnosis is a wonderful tool, and I think we have professionals on OK Clarity that use hypnosis, although people have been scared of the term. But it's funny that you just used that term, because it was one of my questions. I didn't want to like throw it at you, but it was like, how does this compare to hypnosis? Because it sounds kind of the same, where like you're taking away that ego defense, just in a medical assisted way versus like a hypnotic method.
Right.
Is that correct? Or
yeah, exactly. But it's a very internal experience. So ketamine is actually the only drug that currently is FDA approved to be used for treatment of depression. And it's given in 4 different ways, but I'm dealing with one of them at the moment. And there are other drugs, MDMA, which is called ecstasy when used illegally.
Okay.
There's shrooms, which is psilocybin mushrooms that are a natural occurring. So, and there's others that are not. There's LSD but each of those is now being studied and pretty close to being legalized in forms in the next 2 years. In this country and others, Israel's very ahead on that. Israel has a program to deal with PTSD using MDMA that's gotten a lot of press, because people whose lives have really been stopped, because of war, things have really been helped. So that brings me to what is it used for, really? What kind of medical application?
Exactly.
So the legal way that I'm dosing ketamine is through a tablet, and it's really used for depression, anxiety, PTSD, OCD, bipolar, and of course there are people who are they might not have a mental health diagnosis per se, but they're on a growing journey, and they know they've got some emotional stuff holding them back, and they can't get to it, and talking doesn't work. People know that already. There are forms of talk therapy certainly that do work.
Right. I'm happy you said that. I was going to stop you. I was like, you can't say talking doesn't work. Not on my platform.
Right. Like, we're out of business now.
Totally.
But
I mean, there's an art and a science to talk therapy. but I understand what you're saying, but I wanted to be
Yeah,
clear for the layman that like for some people they're stuck to a certain point where they're talked through, but they need something else, whether that's a different type of modality like EMDR or
yeah.
hypnosis or going to some treatment center or some like getaway like that claim to open people up in different ways. Or now the new thing, the new kid on the block is the psychedelics. So like that's
Right.
kind of like what we're referring to where when we say talking doesn't help, it's like it helps many people to take it takes them all the way, and some people need something to progress them after they get like once they get really stuck in some way.
So that's what I feel like we are on the cusp of putting everything in the past together, seeing what works, what doesn't. This is
Mm-hmm.
nothing new. It's just got a new application
Mm-hmm.
with the right education, controls, safety,
Mm-hmm.
vetting of, it's not something for everybody.
Right.
It can really be helpful.
Mm-hmm. And you said the issues that you would primarily use it for, aside from the personal growth journey, which we're not going to address today, but like interesting, the one that's you said like depression, and in our earlier conversation you had said treatment resistant depression, which I know many people struggle with. Then you said OCD, so I wonder if it's like severe OCD and OCD that's very like resistant to treatment, if that's a thing, like with medication and stuff. With that, is that like has that been proven that it helps with severe OCD?
Um, it's been shown in studies, proven.
Okay, proven is a stronger word. Okay.
Yeah.
So
Um,
the one that surprised me was that you said bipolar, because like I feel like that's like taking instability. I'm like, like I feel like taking such a drug is creating some instability. So like I wonder, I'm just curious about
correct.
that. My naivety.
And that also occurred to me, and I
Okay.
wasn't even talking about bipolar until I learned more about it, that it
Mm-hmm.
is effective, with KP.
Mm-hmm.
And I realized a person can have bipolar and be well regulated or well medicated. It
Mm-hmm.
doesn't have to be crazy, not if they're psychotic, not if they're,
Mm-hmm.
non-functional.
Right.
Obviously, it's not for somebody with schizophrenia, not for somebody who's an alcoholic and is
Mm-hmm.
using it in any therapeutic means.
Mm-hmm.
There are some contraindications.
Right. Addictions.
Um, it's actually very helpful for addictions, although we're not using it like that. That's really being studied more as something for MDMA.
Okay. Interesting.
Yeah.
Um, I had another question come to my mind, but it just eluded me. Um, it will come to me maybe when the live is over, but then I'll submit it with all the questions.
All right.
Okay, cool. Who do you say it's not for? Like,
Yeah. Somebody who's psychotic, schizophrenic,
okay.
or in active addiction, and they're using it.
Right. And would you say, like, I guess this was my question, like, how is it helpful in the sense of, like, let's say with bipolar, right? Like, does it reverse the bipolar? Does it help them make more, like, if bipolar is already being managed, then, like, how is this assisting? Like, with depression, I can understand that like, it does some sort of, like, chemical balancing. So I guess with bipolar, does it do that as well? Like, I'm kind of like,
Yeah, it's a good question. It's not something I've learned too much about, tell you the truth.
mm-hmm,
More with anxiety and depression is where
mm-hmm,
I've focused it.
mm-hmm,
But I would imagine,
mm-hmm.
because what is bipolar? It's somebody who's going from one state to another.
Sure.
And it's coming from, definitely it can be hereditary and chemical,
Mm-hmm,
but it's in reaction to very often experiences, feelings, the way they're interpreting the world. So what ketamine does, it doesn't put something in. It opens up. It allows a person to see what's in there, see
mm-hmm,
what's like being held away from them in their mind, from their emotional reality, and
mm-hmm,
and not be so scared of it, and not be so
mm-hmm,
threatened by it, and say, oh, I can integrate that. It's not such a bad thing. And
mm-hmm,
there are protocols, how often, how much.
mm-hmm,
It's never just done, here's some drugs. It's
mm-hmm,
always we have some prep sessions talking about it.
mm-hmm.
big thing is that it's really more patient directed. It's not just, here's your antidepressants, go home and let me know what happens in a month or so.
Yeah.
It's prepared for by setting your intention,
Mm-hmm.
knowing what your issues are and what you want to work on, feeling safe, having a person with you, to support you, and
Mm-hmm.
following it up right away with a therapy session, either that afternoon or the next day.
Mm-hmm. And I
Usually,
want to get more into the specifics of that on our next live. I really want you to like walk us through the process of like what happens from somebody telling you, "Oh, I'm interested in KAP," or like you having someone coming to you as a new client, and I guess like a current client. I would love to like walk through those two processes in our next live. I
right.
feel like that would be very interesting for people. This was amazing. We're at our 5 o'clock mark, so I said that I would pop off. Then I know you have a 5:15. I'm just looking at some notes that I had here to see if like we skipped anything essential. I think we pretty much hit like the bare bone basics and like the macro. I think that there's so many more details to go into. Again, like I do have some knowledge of this from you and just from like podcasts that I've listened to in the past. But like, so I'm thinking that maybe people that are listening are like completely clueless. I'm confused because maybe we didn't go enough like nitty gritty for those people.
Yeah.
So if anyone's watching this over, or when people watch this over, I should say, please submit your questions. I want to hear them. And Chava and myself will do another live, God willing, next week, and we will address some questions. And if we need to do a part 3, we'll do a part 3, because I think this is important to like really, understand. And I think that it can do a lot more harm when we don't understand it. You know what I'm saying? So I think that bringing that education to the community is essential. So that's going to wrap us up for today. Any final things you wanted to say, Chava?
Yeah, I think that it's important to know that it's not just another thing. It will find its place. Yes, and I'm excited about it. But most people don't know too much about it. Within a year, we're going to have a lot more people educated. But I want to emphasize that the amazing thing to me as a clinician is I've been working with people for years fighting against their defenses. They want to kind of rid themselves of reacting and being reactive and too sensitive and getting triggered all the time. And this is something that in clinical trials for 20 years has continually been proven really dealing with depression that hasn't been lifted, with anxiety that hasn't been brought down, by allowing a person to see, it's not so scary in there. There's not such big, terrible things.
Demons, right? It's like it's basically giving voice to the so-called demons, and then like integrating them into society. It's like taking those people that are like in prison for no good reason, and like saying like, "Hey, you can come back. You're not a bad guy." So that's really cool. And you've been using this for the past how long? It's just become legal, right? Like,
yeah. Well, ketamine has been FDA approved since 2018.
Okay.
In one particular form called Spravato. It's put out by Johnson & Johnson. And it's legal to be used, like I said, in hospitals for, surgeries, for pain, PTSD, etc. So it's used in different forms for those other things. So I just started using it this year.
And you've already seen with your current clients, like
Wow.
Massive wow.
Yeah. It's
so cool.
It's really gratifying. And as a therapist, it's like, that's what we always learn. Just get out of the way. I'm not here to teach anything, just to help move you and show you what I see. And it's just another tool to give a person more of themselves back. And it's great.
Exactly. I love it. And like you said, it's like, it's going to find its place. And that doesn't mean it's for everybody, like just like EMDR is not for everybody and hypnosis is not for everybody. And 1,000 other modalities are not for everybody, but for the people that it's helped, it's life-changing. So I think that, again, giving it a voice is really important.
And the cool thing is I'm mixing together modalities I use anyways. EMDR, IFS,
Sure. Because like we touched upon this, like the therapeutic relationship and alliance, it's not just like a medical transaction. It's much more of a psychotherapy intervention.
Right.
Amazing. Okay. Thank you, Chava. Thank you so much. This has been amazing. So again, for anybody and everybody watching this live or watching the recording, if you have questions, don't be shy. DM them on OK Clarity, or you can DM them to Chava. That's totally fine as well. we will collaborate on them and then do another live hopefully next week where we answer them. Alrighty, take care. Thanks, Chava. Have a good one. Have a good evening, everybody, and thanks for tuning in on this no notice we gave people. Take care. Bye-bye.